Modern research has found that probiotics and oral probiotics are effective in getting rid of oral thrush or oral candidiasis. But let us first state some facts about oral thrush. Oral thrush is also known as oral candidiasis, oropharyngeal, or just thrush occurs when a yeast infection develops inside your mouth. Infants and adults get it. Older adults with a weakened immune system can easily fall victim to it. Adults at any age can have it also. People are more likely to get oral thrush if they have conditions that weaken their immune system, example anemia, diabetes, HIV, leukemia. If they take drugs that suppress their immune system, take antibiotics or corticosteroids, which are a class of drug that lowers inflammation in the body but also reduce immune system activity. If they are treated for cancer with chemotherapy or radiation therapy, these treatments weaken the immune system, and a weakened immune system provide the environment for a yeast infection to occur. If they smoke cigarettes. If they wear dentures, which may encourage poor oral hygiene. What are the symptoms of oral thrush? It is not uncommon that there are no symptoms of oral thrush in its early stages, but as it develops, one or more of the following occur. Yellow or white patches of bumps occur on your inner cheeks, tongue, gums, tonsils, or lips, and if you scrape the bumps, bleeding will occur. There is burning or soreness in your mouth. The corners of your mouth become dry and cracked. You will have difficulty in swallowing and experience a bad taste in the mouth or no taste at all. In some cases, oral thrush can affect your esophagus, though this is uncommon. The overgrowth of the Candida albicans that cause oral thrush can also cause yeast infections in other parts of your body like the vagina, penis, under the breasts, and in very serious cases some of the organs in your body when systemic yeast infection occurs. Causes of oral thrush. Under normal conditions, when your immune system is strong, all the microorganisms in your intestinal tract work together without disruption, doing useful work. The problem arises when your immune system becomes compromised and weak. This causes an overgrowth of the Candida albicans fungi in your gut, which obviously cause an imbalance of the microorganisms residing there, and if not treated immediately or in a timely manner, you start to experience the horribly and uncomfortable symptoms of the yeast infection in your mouth, vagina, and elsewhere. Normally a small amount of the Candida albicans lives in the mouth and other parts of your body and in control by and in harmony with beneficial bacteria, but when things get out of control, as mentioned above, yeast infection occurs. Is oral thrush contagious? If you have a breast yeast infection or nipple yeast infection, you can pass the fungus to your baby while breastfeeding. Your baby can also transmit the fungus to you if they breastfeed when they have oral thrush. Your baby can also get thrush from his or her mother's skin, because of the physical closeness between mother and child, even though the mother has no signs of yeast infection, because the Candida yeast can live harmlessly on the mother's skin. Here are some signs of yeast infection on the breast or nipples. On or around the nipples, there are a burning or itching sensation, white or pale spots, shiny and flaky skin, and pain in the breast during breastfeeding. If any of these symptoms occur, it is advisable that baby and mother be treated quickly, so as to prevent the cycle of transmission to and fro. Some of the treatment are treated the baby with antifungal medication and apply an antifungal cream, such as terbinafine, Lamisil, or clotrimazole, Lotrimin, to your breast, and always sterilize equipment used, example pacifiers, teething rings, bottle nipples, breast pump, etc. How to treat oral thrush. Conventional medication is normally used to treat oral thrush. These medications provide temporary relief of the yeast infection, have side effects, and are generally temporary cures, and there is the great possibility of recurring yeast infection. Victims suffering from the discomfort and embarrassment of yeast infection in all its forms, including thrush and oral thrush, are now seeking out and using natural remedies including probiotics, and changing their diet from unhealthy to healthy by primarily dropping sugary foods and including lots of vegetables, some particular fruits, and probiotics. Your doctor may prescribe one or more of the following treatments for oral thrush. Fluconazole, Diflucan, an oral antifungal medication. Clotrimazole, Miselex troche, an antifungal medication that's available as a lozenge. Nistidine, Nistop, Nyata, an antifungal mouthwash that you can swish in your mouth or swab in your baby's mouth. Itraconazole, Sporanox, an oral antifungal medication that's used to treat people who don't respond to other treatments for oral thrush in people with HIV. Amphotericin B, Ambisome, Fungazone, a medication that's used to treat severe cases of oral thrush. The duration of treatment depends on the severity of the yeast infection. The yeast infection goes away after treatment and in many cases, it returns. Infants may have several episodes of oral thrush in their first year of life. To learn more about yeast infection in all its forms and how to get rid of the symptoms of yeast infections in 12 hours and the yeast infection itself naturally and permanently in 2 months, click on the link below. www.alexand.com. Simple home remedies for oral thrush. Your doctor might also recommend home remedies or lifestyle changes to help treat oral thrush or stop it from coming back. When you're recovering, it's important to practice good oral hygiene. Here are a few tips. Use a soft toothbrush to brush your teeth to avoid scraping the bumps caused by thrush. After you finish your treatment for oral thrush, replace your toothbrush if you wear dentures. Always clean them properly. Avoid mouthwashes or mouth sprays unless your doctor has prescribed them. Rinse your mouth with one of the following: salt water, a solution of baking soda and water, a mixture of lemon juice and water, a mixture of apple cider vinegar and water. Practice good mouth, oral hygiene by brushing your teeth twice a day, flossing every day, and visiting your dentist on a regular basis. If you have dentures, remove them before you go to bed, clean them daily, and make sure they fit properly. If you have a corticosteroid inhaler, rinse out your mouth or brush your teeth after using it. It might also help to eat yogurt that contains beneficial bacteria or take a probiotic supplement. Complications of oral thrush. When your immune system is weakened by some of the reasons mentioned before, the oral thrush can spread to the esophagus and can also enter your bloodstream and cause systemic or invasive candidiasis, yeast infection, in which the infection spreads to your brain, eyes, heart, and other parts of your body. The result is a potentially life-threatening condition known as septic shock. Recent research backs probiotics use as effective against yeast infection. Recent research has found that essential plant oils with antifungal properties and which are considered probiotics are becoming very effective in the treatment of invasive Candida. Cinnamon oil, tea tree oil, and clove are found to be very effective against Candida albicans in this area, are clinically safe, and have other health benefits like antioxidant and anti-inflammatory agents. Other studies suggest that eating certain probiotic foods or taking probiotic supplements might help limit the growth of C. albicans. However, research continues. 2007 study published in the Journal of Dental Research. The trial showed that those from the probiotic group had significantly lower yeast cell counts at the end of the study period. The trial concluded by saying that probiotic bacteria can be effective in controlling oral candidiasis. Additionally, in 2012, a Brazilian study, published in the Brazilian Dental Journal, showed that the consumption of a specific probiotic yogurt drink 3 times a week over a period of 30 days, led to decreased prevalence of Candida. In the test subjects' saliva samples, coupled with a statistically significant increase in specific anti-Candida antibodies in the mouth. The researchers summarized that probiotic bacteria reduced Candida numbers in the oral cavity of the elderly and increased specific secretory immune responses against these yeasts, suggesting its possible use in controlling oral candidiasis. Among the complementary and alternative therapies listed by the University of Maryland Medical Center for thrush, probiotics containing Lactobacillus acidophilus and Bifidobacterium topped the list, especially when taking antibiotics that may eliminate the friendly bacteria that prevent thrush from becoming a health problem. Recent studies have shown how probiotics treat common tooth-related problems like gum disease and help tooth decay. Researchers in Sweden and Denmark have found success in treating thrush oral candidiasis, a condition experienced by nursing home residents, with a probiotic lozenge containing Lactobacillus reuteri, according to a study published in the Journal of Dental Research. August 17, 2015. Clinical trials of probiotics for oral Candida infections. On the other hand, studies conducted by Mendonca et al. 2012, Ishikawa et al. 2015 and Kraft Body et al. 2015, reported a slight or moderate improvement of oral candidiasis when patients were treated with probiotics. Dos Santos et al. 2009, reported a drastic improvement of oral candidiasis upon probiotic treatment. Antibiotics and the gut flora. Taking antibiotics is one of the main causes of an imbalance in the microorganisms in your gut. They not only kill the bad bacteria they are supposed to kill, they also kill the good bacteria as well. So particular good bacteria are used to replace the bad bacteria that are killed by the antibiotic. Key facts about probiotics and antibiotics. You should know. Antibiotics deplete the populations of natural friendly bacteria that live in our gut, known as the gut microbiome. This may result in digestive discomfort including such as diarrhea, nausea, indigestion, and low energy. Probiotics can support digestive health in those taking antibiotics. Rather than waiting until after the antibiotic course, it's best to take a probiotic supplement which has been designed to take alongside antibiotics, to help maintain balance in the gut microbiome. Antibiotic resistance is becoming increasingly common, exacerbated by patients not competing with antibiotic courses. Taking probiotics with antibiotics may help to reduce digestive discomfort associated with antibiotic use and enable individuals to complete the full course of antibiotics. Lactobacillus acidophilus rosal 52 and Lactobacillus rhamnosus rosal 11 are two probiotic strains shown to reach the gut alive even when taken at exactly the same time as antibiotics. Health professionals can visit these strains' entries in the probiotics database. Lactobacillus acidophilus rosal 52 and Lactobacillus rhamnosus rosal 11. The best time to take the probiotic Lactobacillus acidophilus rosal 52 and Lactobacillus rhamnosus rosal 11 is at breakfast time, regardless of when the antibiotic is recommended to be taken. If taking other probiotic strains with antibiotics, the advice is dependent on the supplier, but the standard recommendation is to wait at least 2 hours after your antibiotics before taking probiotics. It is best to select strains that have been extensively researched alongside antibiotics. Take probiotics with your antibiotics instead of waiting to finish your course of antibiotics. If taking Lactobacillus acidophilus rosal 52 and Lactobacillus rhamnosus rosal 11, consider taking them with breakfast. These two strains can be taken at the same time as your antibiotic. If taking a different probiotic supplement, wait at least 2 hours after your antibiotics before taking probiotics. It is important to always follow the advice from your doctor, and always take and finish a course of antibiotics as prescribed. If you have already finished a course of antibiotics before being recommended a friendly bacteria supplement, better late than never. By all means take a probiotic now. For next time, you know you can take them during as well as after. It simply isn't a question of probiotics or antibiotics, it's a question of probiotics and antibiotics. Conclusion. Even though more research has to be done to identify the best strains of probiotics for treating oral thrush, studies so far have supported the general theory that the use of probiotics and probiotic foods have been successful in treating oral thrush and other forms of yeast infection. It makes sense that all other elements of a natural anti-Candida plan should also be adhered to, in order to get the best results, rather than simply adding friendly bacteria to target the oral flora. Elimination of sugars and refined carbs is especially important as sugar sticks to the teeth and encourages yeast overgrowth there, whilst also altering the pH of the mouth. To learn more about yeast infection in all its forms and how to get rid of the symptoms of yeast infection in 12 hours and the yeast infection itself naturally and permanently in 2 months, click on the link below www.alexand.com.